community health promoters, individuals that work from household to household, and their work, very minor. Just check blood pressure, check blood sugar, ensure that they identify pregnant women who are in their households and teenage mothers, and encourage them to go for prenatal clinic, and equally ensure that they distribute commodities, drugs, assessment of common childhood ailments among the children. And equally, the work of the community health promoters is joined to a formal facility through referral system. So our CHP is our level 1, and then moves to refers people to the level 2, which is a formal health facility. When we go to facility improvement financing, initially in Kenya, money meant for health would be reallocated at will. It goes to roads, it goes to disaster management. You have spared some little money for maybe some outbreak, and then it's just reallocated. But the Facility Improvement Financing Act, which is now in force, makes sure that we have ring-fenced every coin that is meant for health, whether it is in terms of donation, whether it is from the exchequer, or any money that comes in for health. Then we have the Digital Health Act of 2023, the interoperability of data from the patient to the facility, that if you're referred from a level 2 to a level 3, then you'll find your data there. You're referred from level 3 to level 4 and all the way to the tertiary facilities, then you find your data there. Equally, in terms of bodies that regulate health systems, we are able to have data of all our human resources for health in one place, and we are also able to know that this health, the skilled health workforce are working at the specific facilities they are employed, and they will not fake that they have treated somebody. Probably you are 500 kilometers away and your number has been used, then the system detects and you do not get paid. So the Digital Health Act helps us to make sure everything is in one superhighway, one digital health superhighway. And finally, the other act was the social health insurance financing. Really, only 20% of our people used to access services through our National Health Insurance Fund. But we have broadened it to ensure everybody is not left behind, from the informal settlements, informal sector, and to the employed. And the one thing that we have done is to ensure that the Social Health Insurance Agency has now 3 funds in it. Instead of the just one fund, we have 3 funds. And the first fund, which is the primary healthcare fund, it's exchequer driven, so the government pays. The government pays claims to facilities, directly to the facilities, the primary healthcare facilities. And these facilities, they have been mapped out into primary healthcare networks. So we already know in a certain geographical area, these are the number of facilities are here, and going by the population that is in that place. You treat a patient, you're refunded. Then we have the Social Health Insurance Fund, which is pooled, money pooled together. You pay your 2.75% of your gross, and that is for everyone. And this money is now used to help people access services at the secondary level, where you need maybe specialized care. Then we have the final fund, which is the the emergency, chronic, and critical illness, long-term ailments, emergencies. In my country, we have what we call border. border. And you'll find in the informal settlements, that's the mode of transport. And many a times is when we get accidents here and there. And when you take them to facilities, they are requested to probably pay a deposit, and they do not have. That is why the government set up the emergency, chronic, and critical illness fund that is under the Social Health Authority. And it's also exchequer driven, so it's the government that pays for whatever excesses that you could be having from the secondary treatment. Therefore, that's the base that we built, because we realized if you want to roll out universal health coverage, then it must be anchored on very strong roots. And the only way is to anchor everything into law and ensure that people are following that law. Therefore, primary health care is taking the center stage of all that, if you realize. We have also introduced the National Equipment Services Program. We have requested all the county governments to give us their needs, so that the National Equipment Services Program, we are able to equip the facilities. Now that we already have the insurance for everybody, but we need facilities to also be in good shape in terms of infrastructure, equipping the facilities, human resources, and any other that comes with it. We've had compelling examples from Kenya and other countries providing that we are not alone in this journey. I am sure Kenya is just an example.